India's healthcare system is advancing swiftly with technological innovations, cutting-edge research, and revolutionary treatments. Yet, a silent menace lurks in the shadows: cervical cancer, the second most prevalent cancer in India. Often undetected and under-discussed due to a dearth of awareness and resources, the disease continues to impact lives. Caused primarily by the human papilloma virus, HPV, cervical cancer can remain dormant within an individual, quietly contributing to the transformation of healthy cells into cancerous ones. The stark reality we face is that every 7 minutes, one woman in India loses her battle with cervical cancer. This risk can be significantly reduced through preventive measures such as HPV screening tests and timely vaccinations. At this juncture, the need of the hour is to bridge the chasm of ignorance and misinformation, which is where organizations like ISHARE come in.
सर्वायकल कॅन्सर बद्दल तुम्हाला काही माहिती आहे का?
नाही आधी नव्हतं काही माहित.
काही नाही माहित आम्हाला.
नाही.
Founded in Pune by 3 visionary doctors, iShare is a non-profit organization dedicated to fostering healthcare access, research, and education through innovative and smart solutions. Over the past several years, iShare has focused specifically on cervical cancer, aiming to break stigmas, dispel myths, and empower individuals with the right knowledge and healthcare resources. By providing education and access to screening and treatment, we aim to bridge the gap and ensure that rural populations have the same opportunities for early detection and effective care as their urban counterparts.
When I came back to India, having come from the NHS, which is a publicly funded, health for all system, India was so different. It posed a lot of economic, social, cultural, huge number of problems. And one of the main problems was affordability. 3 friends that all of us who are doctors got together, and we decided that we must work in the field of medical access.
In India, breast cancer and cervical cancer are the number 2 top cancers that are affecting women in India today. And as an NGO committed to bridging gaps in healthcare, furthering women and children's health, we cannot neglect the mortality from breast and cervical cancer.
Many people don't know is that all these deaths are almost all preventable. Countries like Denmark and Australia have almost completely eradicated cervical cancer. And they have done this through a combination of vaccinating children in their teens and surveillance, that is testing through tests like pap smears for all women between the age of 30 and 50. In India, there are already about 450 million women who are past the age of vaccination. And the only strategy that can work for women like this is screening. We are able to come to the market by offering a very, very high quality screening program that's up there with the gold standards in Europe and the United States at a fraction of the cost because of some of the innovations that we've done in our laboratory. Cervical cancer testing not only is limited because of the high cost of the testing, but also because testing is quite a taboo in India. Normally, women have to have cervical swabs collected by healthcare professionals, and there's not only physical discomfort getting that procedure done, but people are very shy to get it done.
The women participation that is required for these camps, that only happens when we have a lot of mobilization activities that are conducted, because on the day of the camp, to ensure that women participation, we have to generate that excitement, generate that interest.
हा कसा जातो विषाणू, तर शारीरिक संबंध जेव्हा येतात तेव्हा तो विषाणू जातो, किंवा आपल्या मासिक पाळीमध्ये जर आपण स्वच्छता बाळगली नाही तर तो विषाणू जातो आपल्या शरीरात.
आम्ही सुद्धा आमच्या पद्धतीने प्रत्येक घराघरात जाऊन ह्या गोष्टींची माहिती दिलेली आहे आणि लोकांमध्ये जनजागृती निर्माण केलेली आहे.
समजावताना असं सांगितलं का पॉझिटिव्ह जरी आलं म्हणून काही कर्करोगच असू शकतो असं नाही.
Until we came into the picture, the primary form of collection was a pap smear or via by acetic acid test. But all of these required collection of the swab by a medical professional. We decided that we had to figure out a way to change it. Based on all the learnings we had from watching others, we took the approach of using a self-collection swab, which meant that a woman could take her own swab in the comfort of her own home or in a closed space where there was nobody else in the room. And that led to the number of women becoming more comfortable providing their sample going up dramatically.
Combining this unique sample collection strategy with our high quality DNA based testing has made testing for cervical cancer cheaper, more accessible, and less of a taboo.
In this collective struggle against cervical cancer, iShare has fostered a network of trust and collaboration with numerous communities, corporates, NGOs, self-help groups, community leaders, and medical professionals. Through these valuable partnerships, we are aiming to enhance awareness and understanding of cervical cancer, transforming fear into knowledge and vulnerability into strength.
In India, a large study was conducted by Dr. Shankar Narayanan. That study showed that a single round of HPV screening reduces the incidence and mortality due to cervical cancer, because HPV test is the most objective test which is now being offered to our women in collaboration with ISHARE Foundation and with support from Gharda Foundation. I think this collaboration has really helped a lot.
या कॅम्पमध्ये आल्यानंतर तुम्हाला सर्व्हायकल कॅन्सरबद्दल काय माहिती मिळाली?
डॉक्टरांकडनं कळालं की दर 5 वर्षांनी ही टेस्ट करून घ्यायची.
HPV टेस्ट शक्यतो म्हणजे बायकांनी 40 नंतर आलेल्या तरी बायकांनी करून घ्यावी, कारण त्यानंतर जो आपला गर्भाशय मुखाचा कॅन्सर आहे होऊ नये आपल्याला, किंवा त्याची जर सुरुवात असेल तर त्याचं आपण काहीतरी प्रिकॉशन अजून काय आहे किंवा त्यावर ट्रीटमेंट काय आहे ती आपण लवकरात लवकर चालू करू शकतो. ही सर्व महिलांनी करून घेणं गरजेचंच आहे.
ते आमच्या गावात इतकी सुविधा उरायली, आम्हाला चांगलं वाटतं.
With relentless determination, iShare has screened over 14,000 women at risk of cervical cancer and provided treatment to more than 1,000 women in the past 3 years alone. Our dream? A future where cervical cancer screening is not just widespread, but also free of stigma. We envision an India where conversations around cervical cancer are normalized, access to diagnosis and treatment is equitable, and every woman is armed with the knowledge she needs for prevention and recovery. We continue to strive towards our unwavering mission, an empowered India, unshackled from the clutches of cervical cancer. This journey of change, empowerment, and hope is made possible with the invaluable support of Gharda Chemicals, our testing partner Genepath Diagnostics, and ground partners like Prayas and ISHARE Foundation. We acknowledge their efforts, applaud their commitment, and invite more helping hands to join us in this noble cause to envision that one day India can be cervical cancer free.